Good afternoon, everyone. Just switched it on there. Yeah, I just wanted to start off by thanking you all for giving up your lunchtime to spend a little time with us going over some more information about Chrome and really just looking at what we want to cover today. You know, today it's really a starting point of the journey with Chrome. So really it's looking more at not the clinical side of it. We're looking more at identifying the patient's needs. We're going to do a brief overview of what Chrome's about, but more related to what Chrome is about for your patients. And then we've got some sheets at the end that we can go over. We'll be sharing this sort of stuff with frequently asked questions, etc. But just to let everyone know that the meeting is being recorded, and obviously once we're finished at the end, we'll be sharing a link with you as well. So let me just share my screen. Okay. So I'm hoping that everyone can see the screen. Whether someone can, oh, you can. If you want to ask any questions, just pop them in the Q&A chat, and we'll answer any questions at the end. But if someone could give me a thumbs up, just to let me know you can see the screen. Anyone? We'll crack on. Yep, cool. Thank you, Lucy. Thank you for that. So yeah, like I say, today's presentation really is just to talk through from a front of house perspective, and really just that starting point of the whole journey with the patient. But the first thing I just want to sort of put some faces to names for those of you, because I know obviously all the practices on here would have been doing Chrome maybe for some time. Maybe you're new to Chrome and you've maybe dealt with some emails with some of the guys or faces. So it's quite nice to put some names or faces to names. We're based in Ireland, as a lot of you already know, so in a beautiful part of the world in County Fermanagh. As you can tell from my accent, I'm not based there, so I'm actually in Essex. So I'm sort of over on the mainland side of the UK, sort of driving up and down and seeing seeing customers, shall I say, up and down the UK. You'll see a list along the bottom there. There's lots of other products that we do as part of Enquiries 3D, which is our digitally led lab. But Chrome is at the heart of everything that we do. So as you can see there, you've got a few faces to names that you've probably dealt with in the past, like Jenna or Noel, or if you've dealt with Milan in the technical side of it as well. So as we said, really at the heart of everything really is the patient. So the focus for everything that we do and everything that the treatment is geared towards is all geared towards the patient. And basically, we need to remember that, you know, obviously for the patients, this is what we're doing. So it's life-changing treatment, as you can see here with this particular gentleman on the screen now. We're changing people's lives, but obviously it's a really personal journey. You know, it could be, you know, everything from, you know, failing teeth. It could be a really emotional journey for them, but we also need to remember that we're going to come up against barriers. And those type of barriers can be things like cost. It can be sort of fear of the chair. It could be quite anxious about how painful the procedure is going to be. And these are all questions that, especially you guys at front of house, sometimes will get as well. I know these chats go on inside with the clinician, sorry, in the surgery. But as you know, sometimes you guys definitely at front of house will pick up a lot more information on their way out, you know, in terms of the types of worries and anxieties that the patients has. And hopefully what we're going to do is we're going to cover that off as we go through with some of the sort of slides that we're going to pick up, the frequently asked questions document. And if there's anything that you guys can add to that, please feel free to chip in as well. But ultimately, this is where we're at. Obviously, it's a very personal journey with each of the patients, you know, and like I say, you definitely will be facing barriers along the way in terms of the treatment planning. So what is Chrome and sort of how does it work? So really, what is Chrome? So Chrome for obviously for you guys at the front of house, it's basically a stackable metal guide. Okay, It was created by our lab in America, which is named ROE. And ROE basically come up with this sort of precision plan protocol that we're doing everything sort of digitally led. So James Hamill, who's the CEO of Chorus 3D, he brought the technique over in 2020, and basically it's the world's #1 all-onyx guided surgery solution. So what we're meaning there is around, you know, there's lots of other labs that sort of do stackable guides, but nothing is like CHROME, because basically it's fully patented, as you can see there, so you can't copy it. And we now have the benefit of, obviously, you know, 25,000 plus now of these CHROME guided smiles have been delivered globally. So we have the benefit of tapping into all of this information. So as we said there, it's much more than a metal guard. It's a full end-to-end digitally led protocol. So in terms of what your patient's going to see is your patient will get a preview of their smile. But what more importantly is they're getting a planned procedure that's getting the implants into the correct position that we need them to be for the most desired outcome that we can get. So as you can see there, every step is pre-planned. It's computer designed. We have planners over in the States, and then we also sometimes plan the cases in Ireland as well. So these are people that have dealt with lots and lots and lots of these cases, and basically can take each element and plan for the most desired outcome that we can get. So from a patient's point of view, what is CHROME GuidedSMILE? So basically there's two ways in which we can do full arch surgery. So we can do it hand guided, or you can do it computer guided. So CHROME GuidedSMILE basically falls into the area of computer guided surgery. So it basically takes a certain set of records that we would have gone over, and your clinicians will be very aware of the type of records that we need. We can take this and we can turn this into a guided system that basically delivers the smile that we need. So on the day of surgery, from a same-day smile perspective, is, you know, they get a brand new set of digitally designed, strong, natural looking and natural feeling teeth. So they're going to go home with teeth on that day of surgery because of the planning that's gone in prior to the patients coming in. So with how does it work? So we're going to come into that a lot more, but basically it's a certain set of records that we take, and then we just build the smile from the records that you guys have given, fed into us, and then there's a planning meeting that takes place, and everything is agreed before we then go to manufacture. So what does this mean for the patient? So this is sort of, you know, terminology in terms of when you're speaking with patients. These are really good conversations for you guys to have in terms of, you know, what is teeth in the day? You know, teeth in the day is basically going to mean that they're going to go away with a full set, as you can see from the pictures there, a full set of teeth on that day of surgery. Now, once you start the journey, I don't know if anyone on the webinar has been involved with full arch surgery before, but especially when it's hand guided, a lot of the times, you know, it's a full day. It's a full day in the chair for the patient in terms of the surgery. Then they're waiting for the teeth to be made and then the teeth to be fitted. What we deliver with CHROME GuidedSMILE, because of all the planning that's gone on beforehand, is we can look to deliver teeth. We're saying on here as little as 2 to 3 hours. We'll always say sort of the first case that you do will be around about sort of 4 hours. So that's a good, you know, but we can confidently say if the patient's coming in the morning, it's good to have these conversations with them. But if they're coming in the morning, then in essence, by the afternoon, they'll be ready to go home, get picked up, and start their recovery. So, you know, once again, it's being predictable. It's being able to have these open conversations with them and be confident in what you're saying in terms of the timings of it. You know, if we were going freehand, we wouldn't necessarily always be able to say when the treatment would be finished or when the treatment would end. But with CHROME GuidedSMILE, we can be really confident in terms of saying if you come in the morning, by lunchtime, you'll be going home to start your recovery. So teeth in a day is a big one. You might get customers that will come in and talk to you about that, because from a marketing perspective, you'll see that a lot on the market. What it also then adds is it adds in this long life or long lasting teeth. So our final bridges are made from zirconia. So zirconia is a material that's very well received from the soft tissues. So it's very compatible with the soft tissues. It can almost be described as sort of the gold standard material within our industry. And obviously, if we look after it with proper care, it can last for many years. We can't say a lifetime, but it can last a long time if it's cared for and looked after in the right way. So once again, as we keep going on this patient journey, and we're talking about the expectations of the patients and conversations and wording that we can talk to them about. We can talk to them about, how they're going to have secure teeth, because we go for a fixed prosthesis where it's screwed in. Obviously, we're going to make it comfortable for them, because they would have gone through the whole healing process, and then we would have gone through the stage of the final part of it was once the patient's healed and they come in for their final sort of consultation before their final fit, so we can make the teeth exactly how they want it. We can get, we can look at the bites and everything that we need along that. Obviously, it's functional and it's non-removable as well, which is what patients desire a lot, in terms of, especially if they've been in an ill-fitting denture. This, once again, as you can see here with the lady on the right-hand side, is life-changing stuff. But these are sort of key wordings to look at. It's going to be secure, it's going to be comfortable, definitely functional, and it's non-removable, so it gives them that secure feeling. As we said at the start, I think these are it's a life-changing procedure. So this is it's very personal, as you can see. And what we sort of mapped out for you on the right hand side here is really it's an emotional journey. So it's really understanding, from a personal level, where they fit into. And these are just some sort of bullet points that we put together. It could be any of these things. And as I was talking about at the start, these are sometimes conversations that, as front of house, especially if you're sat at the desk, you guys are sometimes having these conversations more than it comes to the clinicians, because it could be that they were frightened to say any of this when they were in the chair with the clinician, and it gives you a far greater understanding of where they are at and what journey they would like to go on. So is it any of these things? Is it stuff like, they've lost their confidence, they're hiding their smile, masking, their true selves, really, because obviously they're frightened to do any of the above, especially with stuff where, are they in pain or are they in discomfort? So these are really good key points. And like I say, we're going to be sharing this presentation with you anyway, just so that you can reflect back on this. We've got some little bullet points as well that we'll put on the end that you can print off. But these are really key factors for us, which I think we should be looking out for. But ultimately, this is where we want to get to. I mean, obviously, we're talking about this start of it here, being a life-changing procedure. And this is where we want to get to. You can see this lady's before and after. It's unbelievable. And obviously now we're back to, they've got renewed confidence. They feel a lot more positive about themselves. They have a natural looking, beautiful smile. They're able to start eating foods that they haven't been able to eat for years. And for me, the sort of, the freedom from the pain and the discomfort, because we get a lot of denture wearers out there that can benefit from this treatment. And obviously, ultimately, it leads to them having a new lease of life and really being able to embrace that. So why choose us? So really, it's like, why should the patient choose CHROME GuidedSMILE? So what sets CHROME apart from the other products that are out there on the market that we spoke about? So as you can see here from this, this is from data that we've looked at, but obviously it's, we have a 3 times implant failure is 3 times higher rate when the implants are placed freehand compared to computer guided, which we spoke about in one of the other slides. So obviously with the planning that goes into where the implants are going to be placed. You know, we're getting the implants into the optimum amount of bone and getting them into the correct position that we need them to be in to give us the desired outcome that we need for the patient, and also for the long-term benefits of those as well. It's stronger, so you'll see a lot of the other guides that are out there on the market is, you know, people will shop around, you know, as you well know, for treatments, and they will have a look at other offerings that are out there on the market. And one of the things that we can talk about here is our guides, and which is unique to us. Our guides are made from metal, so you'll see a lot of the stackable systems that are on the market can be resin based, which can flex, which can break, especially in full arch. And obviously, as you can see here with our metal guides, they're 20 times stronger than the normal guides that you'll see out there on the market. So it's a really big difference to the other products that are available out there. Probably, you know, faster and more efficient. This is a really key one as well, because if it's someone, as we spoke about at the start, where we're trying to understand the patient's needs or their fears and things and potential barriers that are out there, it could be that, you know, we put in there that chair, you know, being in the chair is a big fear for them. If we could say, you know, if you can turn around and say, look, we're going to cut down your chair side time because of the way that CHROME works, that's definitely going to be something that would appeal to the patient. Because, as we're saying here, because we've done it computer guided, because we've done all of the setup and all of the planning beforehand, it basically allows us to make the treatment far more predictable. So if we can turn around to the patient and say, look, we're going to cut, you know, maybe 2, 3, sometimes it could even be 4 chairside visits out of your journey to get to your full arch, that's definitely something that's going to appeal to those patients that sit in that sort of fear factor of being in the chair, and sometimes even being in the, you know, with the pain and you know, the fear of the pain side of it as well. You know, they know if they're going to have less appointments, it sort of allays any fears that they may have. And also for you guys as a practice as well, you know, that gives you chair time back, that gives you more opportunity to see other patients as well. But the main thing being for with the faster, more efficient time is if you can turn around and say, look, it's 66% less chair time for you, that's definitely going to be appealing to the patients that we spoke about right at the start. And what we've done here is we've just put some of the key facts that we spoke about along the way from a few of the slides. And this is something that you could print off and you could have at the front desk when you're having conversations with patients. You know, if they're asking, you know, what's CHROME about, you know, you can talk about it being the world's #1 full arch guided solution. You know, we can talk about it with the less chair side time. We can talk about the amount of cases that it's done. You know, if we look at other systems that are potentially out there where someone's gone away and maybe potentially sought a cheaper alternative, we can talk about the fact that we have 25,000 arches that have been completed globally, where we can draw on that information, you know, and we know that we're ahead of the game. You know, obviously the fact that we've got greater long-term success in terms of, because we've planned and we're using guides to place our implants. So this is a pretty good little page to print off and have at the front desk for you. So now we just want to get on to talking about, you know, what if the patient's there and they're happy to go ahead, and then obviously now what is it, you know, we're identifying the types of patients that you've got in practice, because, you know, this for me is a different, there's some similarities to the slides that we had sort of 2-3 slides ago, but this one's a little bit more in depth in terms of identifying patients within the practice, because you've probably all got large books, you've got a lot of patients on there, you've got a lot of patients, as we spoke about, that could be denture wearers. You know, they're going to fit into any of these categories that we see here. And really, you know, marketing and trying to draw patients in from outside that are not currently in your practice, that's something that we will cover off at a later date with a different webinar, not from me. But really what we're doing here is really just highlighting the fact that, you know, from my experience and from working within, you know, especially the implant industry now for the last 15 years, you'll find that you've got a lot of these full arch patients that are currently sat on your books internally. And it's really just trying to identify which of these patients, as they come through the door, you know, you probably see them a lot, you know, where they fit into one of these categories that sits on the side, you know, and you can identify those and look at those as being suitable candidates ready to go ahead with the CHROME treatment. So once the patient comes on the journey, this is pretty much, you know, it's a breakdown of what that journey looks like. You know, so if we've identified the patient's ready to go, you can talk about to them really just it's these sort of 5 steps. So we have the exams and obviously getting the records. So that's an important part of the journey. It's an extremely important part of the journey. So the record taking, and there's certain things that we need for them to come in. So normally that would be one appointment where they'd come in, they'd have a CBCT. If you've got one in-house, there'd be some photographs taken, and then also some impressions of the mouth as well, whether that's with an intraoral scanner or just normal. Then on the day of surgery, as we spoke about before, obviously we would have prepped them. They would come in. Obviously it'd be, let's just say it's a morning, and we know that within 2 to 4 hours they're going to be walking out with a new smile, with teeth fixed and in place, and that'll be their temporary. So obviously they'll leave that day with a temporary. With CHROME as well, there's also, it's good because we also supply a second temporary as well, which is there just in case anything's ever needed for these, for the patients. And then on top of that, then obviously you would have your post-ops where they would come back for either suture removal just to see how everything's reacting. Everyone, each practice that I've been in has their different sort of times where they'll get the patients back in, but that sort of post-op appointment will be fairly soon after the surgery. And then obviously once they've healed, which can take, you know, somewhere between 3 to 4 months, once they've healed, sort of the majority of the time, that would be one appointment where we would pick up. So there'd be a second time where we'd need to take some impressions and other records that we'd need to take on the day. The majority of the time, once we get to that healed part, the next appointment where they come back into the chair after the healed part, they would be getting their final prosthesis in. Sometimes we have to do try-ins, but that's very rare. So, you know, normally from there, they come in once they're healed, go through the impressionist, and then from there they would get their final prosthesis. And then after that, it's really periodic checkups, so making sure that they're coming in to see the hygienist, and that, you know, obviously you're making them aware that they need to put these appointments in on a regular basis. And obviously from practice to practice, you're all going to have your different timings and your expectations of the patients so that you can monitor them. So really, like I said, we'll share this with you here, but obviously there's some frequently asked questions that can come up. I mean, really, they're all on here. You know, I won't read them out, each single one, but you can see there's some really good ones in there just around sort of, is the patient, is treatment painful? These are questions that you're going to get. You know, will they be able to fill the implants? That's a good one. And obviously with regards to, is there an age limit to the treatment? I think what we're finding nowadays is that the actual age of the people that are getting full arches is actually getting younger. So it's not really, you know, obviously you have the higher end of the age limit, but then we'll find that they're getting younger. And then we're just covering off some more ones here. Obviously, you know, smoking's a one that you will talk about in practice as well. You know, obviously I've just been to a case last week actually where the lady was a smoker, but she was desperate. She fell into obviously one of the categories that we spoke about before. And she was just so desperate to have the treatment done, and she'd actually given up 3 months prior to the treatment. So obviously this has been the discussion that had been going on for some time. Yeah, and she'd managed to keep that up, and that was something that she was going to carry on after obviously giving up smoking. So, you know, it's always a good conversation to have, because obviously you'll get smokers that are in the chair that potentially might want to carry on, but obviously that's a conversation once the patient's in the chair, and how you deal with that locally. Then there'll be other questions like these ones here. This will be more specific to you guys in practice, really, and just really getting a good understanding of, you know, how much does it cost, or how much does your practice charge? You know, do you have payment plans? Does the initial consultation cost money? You know, sort of where is the nearest provider to me? So if you're part of a larger group, it could be that these treatments are done in specific practices within your chain. And then obviously the other one is how soon can they get started, you know, and then the answer to the how soon can be pretty quick, you know, but it's just all down to the record taking. So once you've got that, once you've got the records in place, once we're happy with everything, then we can plan, and then obviously we can then start the journey in terms of manufacturing. But obviously the biggest thing we always need to do is we just always need to remember that this is a massively personal journey, and obviously we'll share these slides with you at the end, but it's really worthwhile just going over definitely the first bit where we talked about the costs and obviously the barriers around fear and pain and stuff like that, but then also being able to identify the patients that you currently have in practice that would fit into this. So we also have some really good patient information and promotional material. So you can see a QR code there. So if you wanted to have a look at that, you can go on there. So we do different types of bundles, different types of packages, and what you get within here is you get the frequently asked questions. You get some really nice little sort of A5 information leaflets that the patients can go away with, so that it will answer a lot of the questions that they may have. There's obviously patient testimonials in there, and obviously these are real testimonials of patients that we've had over in our practice. And you can just generally increase the visibility around practice. You know, roller banners I think are very underrated. I think they work extremely well in practice in terms of just starting that conversation. Because like I say, it could be, once again, going back to that patient focus, but it could be that they're sat there with, you know, any of the number of the bullet points that we talked about before, but they're just not even sure where to start. And they might see a roller banner in the patient waiting room, and then they'll take that conversation into the clinician, or they might spark the conversation with you guys at the front of house, on the front desk. And obviously we have all the materials here for you to be able to then pass on to the patient to either take away for them to digest, or or action. So hopefully you guys have had time to scan the QR code. You can go in and have a look at the bundles. And obviously you can reach out to us as well if there's any questions that you have after this. So we've got another webinar coming up in August. This one is a good one to really pass on, to let your clinicians know about. Obviously we'll be emailing them as well, but this is critical for the whole practice, to be honest with you, because it's really understanding the record taking elements. We spoke about that before, but it's really understanding the record taking element of CHROME. The stat that we have, that we actually present when we run our 2-day course, is that 7 out of 10 cases stop at the record taking point. So that's quite a high number, because obviously with the way that we're geared up in terms of being computer guided and obviously making sure that we're getting the information absolutely spot on, is because obviously we want to get these implants in the correct position. And everything starts with the records. And Christoph, who works in our lab, is going to be taking a webinar on that on the 26th of August, so just another lunchtime. And for me, this is probably the most critical part of the whole journey with CHROME, is really getting this cracked. And probably the best practices at the moment where it's the most fluid is because we've got the record taking element really secure and really tight, in terms of when we get the information in, we can go straight to planning. But if we get the information in and we, you know, the CBCT's got a bit of scatter on it, or the photographs weren't quite right, it would then be sent back, and then you'd need to get the patient back in. So this is going to be a really good webinar to log into and have a look at. So really, that's me done. So nice and all, you're going to get a nice bit of your lunchtime back, because I've been super quick. But if you've got any questions, please pop them in now. or obviously you can contact us direct. You've got our email addresses, etc., where you can get in touch with us. But yeah, but other than that, thank you very much.